HESI Nursing Leadership and Management Full Practice Questions. Question 1. A nurse is assessing a client who received an 4 fluid bolus for dehydration. Which of the following findings should the nurse identify as an indication of fluid volume excess? Hypotension, distended neck veins, slow capillary refill, weak, thready pulse. Distended neck veins. Question 2. An RN enters a patient's south room to place an indwelling urinary catheter, as ordered by the healthcare professional. The client is alert and oriented and tells the RN he wants to leave the hospital now and not receive further treatment. Which of the following actions by the RN would be considered false imprisonment? The RN tells the client he is not allowed to leave until the physician has released him. The RN asks the client why he wishes to leave. The RN asks the client to explain what he understands about his medical diagnosis. The RN asks the client to sign an against medical advice discharge form. The RN is restricting the patient's freedom to leave the hospital against his will, which constitutes false imprisonment. Question 3. A hospitalized diabetic patient received 38 U of NPH insulin at 7 a.m. At 1 p.m., the patient has been away from the nursing unit for 2 hours, missing the lunch delivery while awaiting a chest X-ray. To prevent hypoglycemia, the best action by the nurse is to save the lunch tray for the patient's later return to the unit. Ask that diagnostic testing area staff to start a 5% dextrose for. Send a glass of milk or orange juice to the patient in the diagnostic testing area. Request that if testing is further delayed, the patient be returned to the unit to eat. Essential to maintain the patient's blood glucose levels to prevent hypoglycemia.